Thank you, Fawn. Hello, everybody, and welcome to LGE Plus Unplugged April 2024. I've lost count. I think this is now the 5th LGE Plus Unplugged, and we've been getting some good feedback about the sessions. So last time we had Lord Victor Adebowale. If you haven't seen that one yet, it is available on YouTube and the LGE Plus team site, LinkedIn page, various locations, or you can give us a shout at Essex Partners email box to ask me to send you the link. Catch up. We are recording this session, so your questions will be recorded, and that's only mainly for people to hear Cormac back if they can't be here with us today. I've got with me not just Cormac Russell, who we are about to introduce, but I have Louise Voice from Active Essex. So we have worked as Essex as a place with Cormac for many years. I think I first met Cormac, something like 2012, maybe earlier than that. And he's here to talk to us about how communities can thrive as assets to and for themselves, the strength and wealth and so on of all of that. And we've heard that in the title, but Louise is going to explain to us how Active Essex are currently working with Cormac and Nurture Development. And we might also hear a little bit from Louise at the very end about where we're going next. Before I hand over to Louise, though, I will let you know, usually in each Unplugged session, I trail the next one. So I should be telling you excitedly about the date, time and speaker for May. But for various reasons, we have struggled to secure a speaker for May, although I've actually got some booked in well beyond May into the summer. So if you've still got further suggestions that you haven't mentioned to me before of people you'd like to hear speak, do ping me a note of a suggested speaker. We will approach them and try and book them in. We always aim for, as I say, a mealtime session, so breakfast, lunch or twilight in the last week of each month. So we're looking for the last week of May, somebody who could do a breakfast, lunch or end of the day session that you can listen into on your commute or while you're eating a meal or how you wish. So Cormac is going to lead his own sort of timings in terms of chat and questions, so he'll let you know when he wants you to interrupt him. But over to Louise. Thank you.
Lovely, thank you, Kate, and hello everyone. I'm not going to take up too much time because I know you're all here to listen to Cormac and his amazing words, but I just wanted to give a little bit of a forward note, I guess. So as Kate said, I work for Active Essex. I'm a relationship manager and I lead on our strengthening communities work. And like Kate said, Cormac has been working in Essex for a number of years. But since 2019, we've been working really closely with Cormac and Nurture Development at Active Essex through our local delivery pilot. I guess in order to support communities to use physical activity in particular, so that they can become more connected, resilient and healthier. So working with Cormac and his team has given Active Essex and our range of system partners, community partners, the opportunity to really grow our understanding and use of asset-based community development and think differently about the work that we deliver in a place. And so since 2019, through our partnership, we've been able to support 365 individuals to attend 2-day workshops with Nurture Development. We've done more intensive training with ABCD guides across the county. And last year I was privileged to be part of the Essex Stewardship Circle, where we brought together system leaders, I think some that are probably on this call today, where we had 12 months support from Cormac and his team, support, guidance, mentoring and training, so that actually as a system we could work together to change the way that we approach, deliver and develop our work. And I guess getting an understanding that actually the real power and strength lies with those local communities working together to use their skills and energy to achieve actually what really matters to them. At Active Essex is a really exciting time for us, and even more important for us to support these changes and taking an asset-based community development approach, particularly as we move into the next phase of our place-based expansion and deepening. And ABCD absolutely is going to be core to everything that we do, and we'll continue to work with Nurture Development around that. So without further ado, I'm going to introduce Cormac, who is the founding director of Nurture Development, author of books and publications. And for 20, hopefully I'll get this all right, Cormac. And for 25 years, Cormac's worked across 35 countries around the world, training communities, agencies and governments in asset-based community development. So we're really pleased to be able to welcome him this afternoon so that he can share his wisdom and insights around the connected community. Thank you, Cormac.
Thank you, Louise, and thank you, Kate, and thank you to our 50 other friends that are with us for lunch. Thank you for sharing lunch with me and giving me the opportunity to be a guest at your lunchtime as well. Let's see if the technology is going to favor us here. I have had occasion to do with this, presentation in a kind of a storyboard way without slides, but sometimes it's helpful. So because it's lunchtime, what I was hoping we might be able to do is have a conversation. And I thought, I know at least some of you, if not possibly all of you. So I thought that perhaps we just revisit firstly some of the framing. What does it mean to think about things in a strength-based, an asset-based, a community-centered way? And why do I contend that it's not so wild an idea? Because there was a time, I was joking this morning with somebody who asked me to keynote at an international conference, and I said, teasing them, that it wasn't all that long ago that if you invited somebody like me, I would be the wild card option, largely for a bit of controversy. That doesn't seem to be the case anymore. So the basic idea, I think, and I'll maybe spend 10 minutes just queuing this up and stop and check in with you and see how that grabs you. And then I'll go into a little bit more detail on how to do this kind of stuff on Monday morning, or do more of it, because I know many of you are already working in an ABCD sort of way. But just a couple of quick ideas. I think the first one is to just say that it's not such a great proposition to say to the citizenry of any democratic state that institutions have a monopoly on their health. And that if you want to be well, or you want to be safe, or you want to be wise, or you want a just society, that's fine. Just sit back and we'll provide it for you. That kind of social contract is a busted flush. They're trying it in different contexts. It's not working out so well. So certainly in a democracy, the idea would be that no one entity, particularly an institution, gets to have a monopoly on what happens or how things are provided. That's a bit tricky, of course, because that means we have to actually find a way of being in right relationship with the people we serve. So we know that the doctor can't do it all when it comes to health. Lord Chris beautifully put it that, hospitals patch us up, but health is something that's actually created within the community, not exclusively. So it's a tricky balance, because at some level what we're saying is the institutions can't do health or safety or choose whatever you will to us in that kind of unilateral instrumental way. I think we all know that. And we know the third sector can't do it for the public sector to communities either. So how do we get all of this stuff properly aligned? I think more recently in places like Canada and Australia and the UK and Ireland, the Netherlands and so forth, in different parts of the world where I work, I am hearing a lot of people say, look, the answer is to move away from doing change or help to or for people. And we really have to move into a domain or a way of being, if you like, which is about doing change and help with people. It's very appealing, and it's true to a point, but it's not true in every instance. What's really striking, and I want to try to kind of be a little controversial, play a little bit of a wild card here, but I actually don't think it is too controversial to say that not all solutions are best done with communities. There are certain things that actually you're probably better off just creating the space and enabling the community to do by themselves. Now, we may facilitate, we may provide community development, but largely what we're talking about is not taking a leadership role, but encouraging them to take a leadership role and then removing barriers and cheering them on. So in that sense, I think there are four modes of change that need to be aligned in the best way possible. And I think that's what we've been trying to do in Essex in the work that Louise has kindly described there. And we being the royal we, because I haven't really been doing a whole lot at all. As Louise rightly said, it's the people on the ground. And in many respects, I think what everybody is trying to do is to say there's certain things that people can do by themselves, and we ought not to be trying to manipulate or take over or tell them what they do. You know, people have choice and control, and, you know, it's a democracy and so forth. So the more space for liberty and sovereignty and agency we can create, the better. And that seems pretty uncontroversial to me. Interestingly, though, the evidence is actually mounting that this is really important when it comes to well-being. Now, I'll get to making sure that the neoliberal side of the house doesn't hijack this narrative and we end up talking about bootstrapping and telling people they've got to do everything by themselves, including pulling themselves out of poverty. That's not what I'm saying, and I will get to that. But somehow, what I think we've been trying to figure out is, first and foremost, how do we do things in public sector and third sector? So where we're privileged to be policymakers, to be service leaders, to be service providers, how do we do that in a way that both values the people that receive the services, but at the same time also say that we're going to provide those services in a way that enables you also to feel like you can add value to the proposition. So if we're providing healthcare, we're also saying to communities, well, there are things that you can do as an organized community, which are not services, but they're consequential to health and well-being. I'm working with the police department in Colorado at the moment, and I find it very inspiring. And one of the reasons I do is because the police chief, when he goes into communities, he says that our job, and remember, this is in a context where police have done a lot of harm to Black and Brown communities and Indigenous communities in that particular context. He says, our job is not to police badness out of you. Our job is to believe there's goodness here and to create the conditions and the space and the cover for you to discover, connect, and mobilize that. He borrowed the discover, connect, and mobilize from me. But I like the idea that he thinks about himself and his colleagues as trying to discover goodness or trying to enable community to discover how they can create peace locally by themselves with some support from the police, but also with a range of services that are done for them. Ideally, that police force will stop doing policing to communities. So in a sense, that's the ideal alignment. We move from doing things to and for people, and we move into a space where we find ways that we create the conditions where people can do what they can do best by themselves, first and foremost. Then we supplement that with some kind of co-production and co-design. And then it becomes much, much easier to figure out what it is communities would like us to do for them that they can't do by themselves or even with our help. Now, I did say that I'd argue that the high watermark of the future is not the with space, it's the by. And just to illustrate this in a bit of a jokeous way, imagine, just to make it real, imagine somebody came to you as a friend and they said, I've come to the realization that I'm in a relationship that's going nowhere and I want to break up with my partner and I need your help. It would be absolutely preposterous for you to turn around and say, I'll do it with you. In other words, you propose that you will go with your friend and you break up together with whoever it is they're trying to break up with. Obviously, that's something they have to do by themselves. You can coach them, you can listen, you can do lots of different things that would be helpful, but you're not going to do the breakup with them. And one of the things that's really striking me a lot when we hear about people talking about leadership in the co-production sense is I think they're talking about trying to co-produce things they have no responsibility for producing in the first place. And I think what we've really learned in working with Active Essex is that there are whole ranges of things that people do to be active and to be healthy and to be well that have nothing to do with service land. In fact, all of our research is showing that a very significant majority of what people do to be healthy and well, they're not doing while thinking, I'm doing this to be healthy and well. And that's where I really want to go to try to explain the simple proposition of today's presentation is that there are two operating systems alive in social change in the world. One is our institutions, and they matter hugely. And the other is associational life, which largely is most active in places, in neighbourhoods. Not the only way, but certainly is very active there. Now, over the last 7 or 8 years, we've been trying to work to figure out how institutions could precipitate associational life in neighbourhoods to really animate the buy space more. And I think that's a new leadership question. Previously, our experience has been the leadership questions have been, how can we do things to, with, and maybe for communities in ways that save money and provide the best service? We've moved past that question. I think you've moved past that question as a county. And we're really in a situation now where we're trying to think about 3 essential questions. What is it communities can do by themselves if we provide the support, the facilitation, and remove barriers? Number 1. What is it that communities can do with some help? Number 2, and the sequence matters. Number 3, what is it communities need us to do for them? So that contracting, that social contract is the key sequence. It isn't always going to be possible. In the face of a forest fire, we're dealing with that in Alberta and a few different places in Canada at the moment. Obviously, we have to move in, and things need to be done to and for communities to make sure that people don't die, right? But what we're trying to really figure out is, aside from crisis response, how do we take a developmental approach? Let me build on that. I love this quote from Saul Alinsky. It's a bit controversial, but you know, some of what he said was helpful. He says, to give people help while denying them a significant part of the action contributes nothing to the development of the individual. In the deepest sense, it's not giving, but taking their dignity. Denial of the opportunity for participation is the denial of human dignity and democracy. It will not work. And you know, it's actually 38 countries we work in now. We have portfolios in 38 countries. I genuinely cannot find one example of where doing something to or for a community in an impositional or manipulative or social engineering way has ever worked. Maybe you can, and I'm happy to hear your examples if you have them, but I'd struggle. Maybe that's just me. Where we've seen communities really enabled is in contexts where the following 5 rules of ownership have been followed. Some are do's and some are don'ts. And this comes from David Ellerman's work, who was at least an economist at the World Bank and an advisor to the World Bank. So he says the first thing we have to do if we don't want to harm the autonomy and sovereignty of communities is start from where doers are. I love the fact that he calls communities doers. A lot of the time we're thinking about communities in more passive terms, but he sees communities as active agents, as primary doers. So starting where they're at doesn't mean we have to stay there. The second do is see through the eyes of doers. Many of us are trained to see through the eyes of the state. We see things through our operating system, and our operating system is the institution. So naturally enough, some of us can look beyond the bounds of our institution and see through the eyes of a community, but we have to do We have to actually recognize that we're looking at the communities that we're trying to serve through very defined lenses, sometimes quite stigmatizing lenses. He goes on to say that we should respect the autonomy of the doer. Now, this is tricky because if you've got an agenda as an agency and you've got evidence that says this needs to be done, you've done a needs assessment, you've done all of the analysis, it's clear that this community needs an intervention. And maybe not alone that, but the community isn't organized enough to tell you or even to know itself what it needs. And so you have to impose a change on the community. Well, that's breaching rule number 3. You're not respecting the autonomy of the doers. This is tricky ground. And one of the ways that I think we've been trying to do something about that in places like Essex and Leeds and Birmingham and Surrey and lots of other places is to look at the role of community animators in these neighborhoods who actually do the really important work of enabling communities that are quite fragmented and disconnected to come together and find ways that they can find common purpose and common voice. In other words, one of the challenges I think that we face is we can't engage with communities until we first enable people who live there to become a community. That doesn't mean they all have to have group think or they all have to operate to the same mindset. There can be diversity within that. But in, for example, 17 neighborhoods in Leeds, they have supported neighborhood networks and they have supported the employment of ABCD community animators, community builders who are working to build back the social fabric and cohesion of these neighborhoods. So in a sense, using the neighborhood as a primary unit of change. 4 and 5, don't impose change on doers. It'd be fascinating, wouldn't it be, to do an audit of all of the things that we currently do to, for, and even with communities where we're actually imposing the change. We've got a veto on what happens. We've got the money. We essentially hold all the best cards. Imagine we stopped doing that and we said, we are never going to do anything that is impositional. That might actually be quite challenging. I mean, how might you advance public health in the face of a COVID crisis? How might you do planning? How might you have a master plan if you follow that rule? So this has lots of dilemmas attached to it. And the final don't is don't give help as benevolence. That's an interesting one. That basically says don't start creating situations where your funding is contingent on those that receive the funding remaining dependent on you as the benefactor. You have to give that some thought, I think. And that's why I want to stop in a moment or two and tease this out. But I'll give you an example. Trust and Trust, as you know, are quite rightly well known and regarded for responding to food poverty in the UK. And they've spent a long number of years trying to support food banks. They've recently, in line with these 5 rules, they've recently started employing community organizers. Why? Because while they recognize that people need access to food, otherwise they'll starve, they also recognize that the best form of charity or benevolence is the form of charity that works to change the structural inequities that cause the need for that charity in the first place. In other words, the best charity is the charity that works towards not being needed. The community organizer's job is to create an alternative to that benevolence, the food bank, which often comes with stigma, and to create better ways of garnering food sovereignty. So there's a lot in that, and I have 1 or 2 other comments, and then I'll stop. So I think there are ways, of doing this. There are ways of following these rules without dismantling the state. And I think one of them starts with saying, well, let's spend a little bit more time discovering where virtue is afoot already in communities. So instead of going in and delivering services to need, let's take a little bit more time to figure out what are the solutions that are actually already going on informally in neighborhoods. If we're interested in health, what are the health creating capacities in these places? What if we're interested in safety or planning? What is it that communities currently are doing? Discover. And that's exactly what Katie Kelly did in her role as the Director of Housing and Community in East Ayrshire between 2011 and 2021 when she retired. She flipped the narrative and said, before we deliver, we must first discover. Before we as an institution deliver top down, let's find out what's actually happening here. Then she put resources in the places that people lived their lives so they could connect those things that were discovered and get a little bit more innovative and create a little bit more in terms of community alternatives. And she supported the mobilizing of those. One of the things that Katie did was to make sure that at legislative level, people had the power to plan. And so in a sense, and I'll stop here, in a sense, I think what Katie and what Louise and others, yourself included, are trying to do is to change the narrative. And instead of trying to lift communities up by putting them down, starting with, let's do a needs assessment, and then bizarrely conclude that every assessment we do proves that what community need are our programs and services, that we stop a little while and create a little bit of a healthy leadership vacuum by assuming that there may be nascent leadership and competencies and capabilities in the very places we think have problems and are damaged. And we won't know if they're there until we actually look. Most of what is there is invisible. And so that's the challenge. How do we make visible the stuff that's largely invisible? And I'll stop there, and hopefully I've been provocative enough to get a little bit of a debate going, but let's see. So how do I stop sharing this? Yeah, good. All right, I think we've got about 50 people on the call. So let's see if we can, Kate, maybe you can keep us honest in terms of moderation here, but there are a few hands. I think Dave has his hand up. Anybody else? Okay, let's start with Dave.
Thanks, Cormac. It was really interesting, really stimulating subject, and as you say, somewhat provocative too. So I think we have a bit of a crisis right now. Amongst many crises, we have a bit of a crisis in trust in our democratic systems. And I wondered if where is the limit to the autonomy that we can give people that doesn't run the risk of undermining trust in representative democracy? And alongside those limits, who gets that autonomy? Is it all parts of society, irrespective of their wealth and their ability to benefit from that autonomy? Or is it only selected groups that get that autonomy that somebody decides needs that autonomy?
It's a great question, Dave. Thank you. And as you say, this is provocative, and we have to approach these debates intelligently and sensitively, but with compassion too. And I think your point around fairness and inclusiveness is key. So I think the best way, rather than staying too kind of heady on this, the best way is to give you some tangible examples of where this idea that you can have no wellness without fairness is key. So for example, in Leeds, if somebody whose will and preference is not to end their days in a congregate care setting hasn't got the money to create an alternative, and they come in under the charge of the social care system in Leeds, before they had introduced an ABCD approach, they probably would have ended up the care system, regardless, a congregate care system that they didn't want to be, against their will and preference, as a matter of fact. Now, I don't think that's very fair, but in all kinds of ways, that has often happened, to the tune of £47,000 per annum. So that's a dilemma right there for the person, for the commissioner, for the local government, and I would say for the family and the community around that person. But in the absence of a more humane alternative, you can't meet that person's will and preference. Just isn't possible. So you do the best you can do. Now, what would a community-centered alternative look like? There's lots of different ways of cutting this particular one, but let me tell you what it does look like in 17 of the neighbourhoods where they've employed community builders. So take that £47,000 and say, well, instead of seeing this individual as an isolated individual with needs, we're going to see her or him or they as a member of a wider community with gifts and contributions. And we're going to put a community builder in that neighborhood who, number one, can actually work with this person to find out what they value and figure out ways that they can add value in the lives of other people in their neighborhood. And we're also going to figure out how we can keep this person safe in the neighborhood. This is actually happening. For about £30,000, you can employ a community builder who on average can keep 10 people out of congregate care settings, fulfilling their will and preference, and do things like is happening with Robin. Robin was going in the direction that I'm describing, but Robin actually was a retired member of the municipality. He used to work in the parts department, and after his wife died, he just disconnected from society. But one of the things he was passionate about doing was carving walking sticks. He had about 400 of them in his garden shed. Nobody knew about this. And that community builder was able to connect Robin into a role as somebody who actually now mentors young and old in how to actually engage in carpentry and wittering and such like. So in a sense, what I'm describing here is a very kind of granular example of how we include somebody who would have been institutionalized in the active life of their community. At a much higher level, I'll give you an example in Milwaukee, where there had been a huge amount of disquiet and distrust in a lot of services, healthcare services, but also police. And they've developed an initiative called Blueprint for Peace, which actually says to the community, police can't impose peace upon you. We can't regulate gang violence. We need the community to be actively involved. But that can't just be the self-appointed and self-anointed. It has to be all members of the community. And one of the things the police recognized is actually the 15 neighborhoods that are producing the alumni of the prison services are the same 15 neighborhoods that are producing the alumni of the acute end of the healthcare system. That actually in the city of Milwaukee, poverty has a postal code, and so does health inequity, and it's the same. And so they began to talk with their colleagues in public health about health equity. And they started talking with Black Lives Matter and indeed other, civil society groups. They said, what are we going to do here? This is all out of alignment. We've got the resource. Our police are not trusted anymore in very, real terms. There are good reasons for that, but not always. So what they did was they actually took some of their enforcement budget, and they said, no, we're not going to defund the police. That was one of the demands of the city at that time. That would not be a just thing to do. But what we will do is we will find a way in talking with these 15 neighborhoods to figure out what it is they can do if we support them, lane one, what it is that they can do with us, lane two, co-productively, and what it is they want us to do better for them. There's a kind of recognition that actually most communities don't know what the police want, or what they want from the police until they know what they can do themselves. Most communities don't know what they need until they know what they have. So the police force said is, we will resource some of our budget to enable you to get organized, to figure out what are the things that you could actually do which would create more safety, create more peace, create more inclusion. And here's the answer. They said, we want to employ community organizers so that we can fairly organize so that all voices, particularly the most marginalized, can actually come into a democratic conversation, not just about what we want, but also about how we can actually create safety. They, I think, were buoyed up by the fact that Robert Sampson from Harvard, who's the preeminent social scientist on what creates neighborhood safety, is very clear on saying that one of the best ways to create a safe neighborhood is to know your neighbors by first name, to care about their well-being, and to be actively involved with them. That actually has a much greater consequence in terms of neighbourhood safety than the number of police or CCTV cameras or speed bumps or what we do in terms of enforcement. Both are important. So my answer is, I don't think we can organise a fair society from top down. We've got to get on the ground and do the hard work of building associations of associations that can talk to each other and can recognise that they're not just passive consumers of services, they're also citizens at the centre of democracy, and they can do things that are consequential. I don't think people believe that anymore, Dave. I think people think their health is in the hands of the doctor. I think they think their safety is in the hands of police officers. And I think that they think their children's education is in the unilateral hands of a teacher. And they're only partly correct. We've got to change that story.
Thank you for that answer. I think it would be a fascinating debate to carry on, but I feel we should open the floor to others. Thank you.
Thanks, Dave. Are there others who'd like to come in? Hannah, I think I see your hand up. I don't know where the sequence of this, let's just go with Hannah next.
Thank you.
Thank you.
I'm really interested. So you mentioned health creating properties within the community. I just wondered if you could give us an example of what kind of things they might be, and also if we're discovering, how would we go about discovering them?
So one of the things that's interesting, say at the moment, we're working with His Majesty's Prison and Probation Service in Wales. And so the basic question that we're trying to address is, how would you support 100 men to come out of prison? It's men because of just that's the nature of the sample group, and return back into a community context, right? So one of the first things is you don't think about them as ex-prisoners, you think about them as community returners. You take care to find out what it is they can do. And say in Ely, where recently there were riots, in that particular neighborhood, there is nowhere that people can go and have an affordable cup of coffee or, a greasy spoon they can go and get a breakfast. Okay. But what there is in that neighborhood is a very significant probation center, right? Where people on license go and do what you'd expect them to do. And what's quite exciting about the institution is they're beginning to think about how that probation center can go beyond being single purpose to facilitate the well-being in the community context. Now, what's interesting is there's an industrial kitchen in that building, and many of those men who lived there, who've kind of are returning from prison, statistically, by the way, 6 out of 10 of them on the current curve should be back in prison within 6 months if they follow current trends. Now, one of the things that disrupts that is if they can be in associational life with people in the neighborhood in a way that does two things, according to the researcher Isaac Brillel-Tensky, who is the theorist around mattering. The first is that they feel valued in the neighborhood. And the second is that they're able to do something that adds value to the well-being of the neighborhood. Well, many of them can cook. There's an industrial kitchen. There's a need in that neighborhood to have a community kitchen that's accessible. And so by just simply doing that in a non-contrived, albeit somewhat choreographed way, we can create the conditions within which these men can be in reciprocal relationships and begin to start redefining a valued social role for themselves in the neighborhood, which meets the needs of the people in the neighborhood, many of whom may be isolated and not in associational life, to actually have associational life. Brigham University did a study a number of years ago, going back to 2015, of 3 million people to try to understand from a population health perspective what it is communities can do to create health. And one of the things that they found is the most consequential thing you can do is, if you aren't a member of a club or a group, join one. At the moment, Bob Putnam, who became famous, as you know, I see you're a researcher, so you'll know this, but Bob Putnam became famous around social capital, and he's building a loan book. But he's now on the speaking circuit again, and he's got a movie. They've made a movie about him called Join or Die. So the basic statistical frame here is if you're not a member of a club or a group and you join one, you statistically reduce the chances of dying in the next couple of years by about 50%. So there's no known pharmacological intervention that can compete with this kind of statistic. So, you know, in answer to your question, how can community be health creating? By the very nature of what community is, it is health creating. Community is about forming associational life. I can sing solo or I can be in a choir. Being in a choir is better for my health. So in all kinds of ways, I think, you know, you look at the work that Louise was talking about earlier. Yes, it's great that people are cycling bikes. Yes, it's great that people are engaging. But you know what else is great? Aside from the activity, the fact that they're doing it associationally. So park run is really interesting. Now, I could take somebody and I could say, I'm going to set up a program. All of my science, all of my evidence says, this is what you should do. You should eat this way. You should run this way. But what's very interesting is if I feel that I have chosen to do whatever it is I'm doing, if I feel that I'm not a client that's being in some way managed, but I am volitionally in control, I am producing, like in Park Run, you'll often talk with people, and I have, they don't describe themselves as clients. They don't feel that they're on a social prescription. They say, hey, I'm a member. If this wouldn't happen if it wasn't for me. And actually, the sense of being a member, the sense of being, I created this and I add value to the people around me, is actually far more health creating than necessarily the food they consume or the steps that they traverse. All are important, we know that. But this associational piece is key, and that sense of agency is absolutely critical. This is true, Hannah, in relation to safety too. So I'd mentioned Robert Sampson's research. He talks a lot about this idea of what he calls collective efficacy. That sense that I live in a neighborhood where I can join with other neighbors. I'm not talking about neighborhood watch necessarily, but I can join with other neighbors and we can have efficacy. We can have a sense that we are together, united and safe in each other's company. That's hugely consequential as a determinant of neighborhood safety. That's why most informed senior leaders in terms of policy around policing are really moving past just neighborhood watch and are saying, folks, you know what? We really want to encourage you to think about associational life. I love the story. I think there are others who want to come in as well. I love the story from some of our work in Wales of the rugby club who wanted to contribute to what I was describing. And one of the things that happened in the conversation was one of the men, who was a community returner, said, you know, what really bugs me is the number of older people who don't come out during the winter. It gets to 4 o'clock, it gets dark, they're prisoners in their own home. They don't trust me. I don't know what to do. I can't do anything, but I'd love to see something done. And the rugby club said, well, you know what, actually, there is something we could do, and you could help. What we should do is we should do our Thursday night training, tag rugby training, in that neighborhood with their permission. We'll go knock on the door and ask them to make tea, turn on their lights, come out and cheer the kids on. And at the end of it, anybody who wants to actually go to the pub or go shopping or go and get a prescription, what we'll do is we'll make sure in pairs, so there's good, protection, but we'll make sure that the kids connect with the older people and so that there's actually something happening where they feel safe. We'll program that environment after dark. Here, what I'm describing to you doesn't just hit the health targets, it hits the safety targets. And this is important, by the way. Police Scotland, the Unified Police Scotland, their statistics show that 80% of what's coming through the call lines has nothing to do with safety or with policing related issues or crime related issues. It has a lot to do with social isolation. So I think all these things are of a, that's why I think the neighbourhood as a primary unit of change, and I would join Voice and put my weight beside New Local's call for neighbourhood pooled budgets as a way forward, because I think this is a way of just getting out of our silos. I often say silos are where smart people go to do dumb things, because so many of us were trying to, hit our targets based on our silos, but actually there are all kinds of overlapping objectives here. And the neighbourhood as a unit of change would allow us to hit those. That's why it's ironic, sporting interventions create so many other outcomes that have nothing to do with sport at all. Kate or Louise, have you been keeping an eye on the chat? Because I haven't. And I'm just wondering if there are any points in the chat that we should pick up on.
I have, and I think I've
Kate?
answered most of them. They're not questions to you that I'd seen, unless any have just come in, Louise, because I was just dealing with a question that's sort of to do with recordings and things.
Okay.
Yeah, there is just
Thanks,
one about there's just one, Cormac, about the impact. I'd be interested about your thoughts about the impact of social media on communities.
Social media. Well, look, it really does depend on what we mean by social media. If we mean by social media, some of the well-known platforms that, we could debate, but that, still have to be a little bit clearer in my mind about what they're doing with our data, I would be cautious. But if we mean social media by, we're referring to things like Nextdoor or my WhatsApp group in my local neighborhood, then actually I think that could be an asset for community building. Sometimes I'm cautious about some of those Facebook groups that I see, because in many cases, community isn't built by making speeches or by anonymously posting complaints or opinions on sites where I don't see the people that I'm talking to, and I don't actually have to be in a civil relationship with them. So I think they can be good supplementary or augmentary devices, but I'm much more interested in how you build community on land, and then you can supplement that online. My fear is that if we start creating proxy communities online and we're not actually able to get together and do stuff, and get to know each other, then it can be hard to facilitate compassionate and equitable and democratic relationships. So it's as ever, it's a tricky ground. But I think with wisdom and with discernment, they can be an asset. And we find them in our own neighborhood as just a resident, and in all kinds of ways, when it comes to just, getting a lawnmower, getting something that you practically need, I think it's great. Would I suggest that we use them as a platform for resolving conflict? Absolutely not. Would I suggest it's a really good place to debate ideology, political ideology as a case in point? Absolutely not. And particularly in the spaces where we know that there is manipulation. I think I would be, as a citizen, I would be very cautious. Having said all of that, they have their utility. So, proceed with caution, with the hazard lights on as ever. Phil, did you want to come in with a question?
Yeah, thanks very much, Cormac. Been really, really interesting. Just to introduce myself, I work in the Cabinet Office at Essex County Council, and I advise the Cabinet member responsible for communities, among other bits. And she's also been leading on the Levelling Up programme as well. So it's been really fascinating to kind of hear what you've been saying. I just wanted to kind of get your insight into where you may have worked with elected officials in convincing them of particularly new approaches. We're lucky to have quite an innovative Cabinet member, but there's still very much that kind of feeling among members that when you're working with communities, it's sure they can develop it themselves, but we've got to set the groundwork and we've got to set the constraints, and there must be clear measurable outcomes, and we need to know what we're going to be looking for in terms of impact. And all of that can be really, really difficult. But it was interesting where you said, for example, benefits of someone joining a club and then almost feeling like they matter. For sometimes, if that can't be really easily measured and that becomes anecdotal, it's quite hard to then sell members on the idea of that. And also it could of course take take many, many years to see how the community develops over that generational change in terms of how the community develops and strengthens. So just be interested to kind of know a little bit more about how you've worked with elected officials in that kind of context. And also our members are really interested in the idea of supporting parents to almost kind of, it sounds bad to say parent better, but kind of give the parents the space to be able to work with young people to make sure they're ready for school, to help support them properly in the school environment, and just thinking about whether you've worked specifically with the idea of a parent community as well, and how you might have developed and strengthened that.
I remember, thanks, Phil. I remember many, many years ago, the mayor of Oakland, who I think now is the governor of California, contacted Mauricio Lynn Miller, who eventually went on to answer that phone call with a program called Family Independence Initiative. But the mayor's challenge to Mauricio was, how do we get families out of poverty? Everything we've tried hasn't worked. I'm sure you're familiar with, narratives like poverty safari and so forth. So we know you can't socially engineer the end of poverty, that it's really, really critical to pay attention to our history here. Look at what migrant families have done across the course of time in America, Australia, and the UK. And you begin to realize in all kinds of ways, historically, families and indeed clusters of families and communities have been doing really interesting things, which have very little actually to do with state intervention, and may have happened almost in spite of state intervention. And so the mayor was really interested. What might that be? So one of the things that Mauricio did in setting up the Family Independence Initiative, and this speaks a little bit to measurement as well, is he said, well, first of all, let's relocate authority. Most of the time we think about poverty, we think the authority is with the third sector and with the public sector. It's with the institutional world, and somehow, they're going to provide a set of programs based on a needs assessment, and then we're going to measure that, and then there will be outcomes, right? The kind of tongue-in-cheek question that I would lead with in that regard is, so how's that working for you? Because it's not actually working terribly well for the families who are struggling to pay utility bills. By the way, by institutions that are often producing utilities that are quite problematic in terms of environmental sustainability and cost and so forth. Notwithstanding, what Mauricio did was he said, well, okay, if we work on the notion that we relocate the authority to families, and we say to families, what we'll do is we'll create conditions where we give you the space to actually figure out what you think will work, and then we'll find equity to invest in your ideas. So rather than saying, well, because it's safe to do it, isn't it? We'll create a budget program and then we'll give it to the third sector organizations or, to a commissioning body, and then we will deliver through that mediating structure and count it. They basically cut out the middlemen. Now, this started in Oakland, it's gone on to San Francisco and to Boston, and he has actually become a recipient of multiple awards. And he's written a book called The Alternative. Everything you think you know about poverty is wrong. And basically what they have discovered, and they've worked with a number of very creative metrics. What they have discovered is by tracking families' innovation with minor amounts of support and with matching equity, is that actually families are pretty smart. And not alone are they smart, but actually they're adaptive, self-organizing systems. So what families tend to do, like a lot of complex systems, is they organize whereby there are positive deviants in the family systems who tend to find solutions. And those solutions, if you can actually create some kind of way of connecting them, tend to be followed by others. So I won't try and give you a pre-say of the book, but the point I'm making, and I have another example around this, the point I'm making is the key step is to relocate authority out of the institutions into the families. And that doesn't preclude you from measuring. So what they've been able to do is they've been able to say to families, we want you to tell us and track through evaluation what it is that has worked for you. So they actually pay the family members as evaluators to share the data around what it is that they find works for them. And they basically pay them because at the end of the day, the institution is getting that data. If they had to pay, a company to evaluate, it would cost them 10 times that. So they've been able to gather that data. So that's one bank of evidence you could bring to your MP, and you could say, look at that and consider the data. We don't have that at the moment in the UK. There is nobody doing this in the UK. So that's one thought. The other thing we don't have in the UK is a municipal system that organizes itself the way people organize their lives. In Seattle, they do, and it's called the Department of Neighbourhoods. And I think that could be something in this county we should really think about. So if you had a Department of Neighbourhoods, which basically says that we'll think about each neighbourhood as an economic unit, and we'll figure out a way of creating a neighbourhood pool budget to invest in the inventiveness of that community, and we'll pay some money to help you get organised to figure out how to do that. And basically, we took some fraction of a budget from policing and from health, and particularly from the acute end of the system, and we organised it that way. I think what we'd begin to find is that actually the representative democracy would work better. It would scare local members a little initially, but we worked a lot with local members in Trafford, different parts of the UK. And so once they begin to see, like in Seattle, there's a lot in it for them as well, they get quite excited. Final thought, in Seattle over the last 20 years, they have changed the way they fund. This is really key. So previously, the way we funded, I think generally speaking in OECD countries is quite patrician. It says, we'll tell you what we need, we'll give you the money, and then we'll audit you to make sure you do what we think you should. Okay. And they say that's the wrong way around. That doesn't create democracy. It doesn't create agency. So what they've done is they've created the Neighbourhood Matching Fund Scheme, which says to every citizen in Seattle, if you can get 3-4 of your citizens together, your neighbours, and you can do something that's going to contribute to the common good, the common wheel, we will invest in you. And we won't do it in the old benevolent way. What we'll do is we'll do it in an adult to adult way. So for every hour you pledge with your neighbours, we're going to recognise that in the only way we can as a system as having value. We'll give it a value of $15 an hour. So when you come to us, you no longer come to us with cap in hand. We serve you. You're the citizen. And you're coming with 250 hours, which is equity. We'll match your equity, and then we will treat you the way you should be treated, as citizens in the driving seat. We're backing you. We're your servants, not the other way around. Across the course of the last 20 years, they've invested $80 million this way. But you know, it's interesting, Phil. And again, they have the metrics now, right? Because they can actually measure this. $120 million in sweat equity has been leveraged from communities. And more importantly, hundreds of thousands of people who couldn't get involved in the old system, which is if you want to get involved, volunteer, are now engaged. And they can engage in ways that don't just mean they volunteer, because that's only a subset of how people engage in democracy. And so when you talk to those people, they see themselves as something more than just voters. They see themselves as citizens, active in their community, as creators. And that can be measured if we have the political will to do so.
Okay. I think we've got a
Thanks,
mass
Kate.
exodus going
Yeah.
on because we've hit the 2 o'clock point, Cormac. But thank you so much. We are still recording,
Wonderful.
and so people can catch up with the bits they've had to leave before. Just to let everybody know, I did put into the chat that I completely forgot to also welcome, which is an unusual set of guest attendees today, our current LGE 2024 cohort. So we've got our current learners as well. And I'll be in correspondence with everybody who's been here today and beyond with the recording link to today. Thank you, Cormac. And Cormac, one of the privileges of being one of our speakers is that you also get sent the links of all the previous recordings and the future recordings, should you be interested to hear how LGE Plus is growing as a community.
I'd love to.
So thank you very much. And farewell, everyone. If you have any further queries and you're hearing this recording, you know where I am, and come and find me. Thank you, Cormac.
Thanks, everyone. Take care.
Thank you. Bye.
Thank you. Bye-bye.